identify my 3 IM injection sites. The first one is the deltoid, so I'll find my acromion process, 2 finger breaths below, and I'll inject into the middle here, into the deltoid muscle. My second site is the vastus lateralis. Find my greater trochanter and my lateral femoral condyle, break it into 3 sections, and I'll inject into the middle of the middle section here. And then my last one would be my ventrogluteal. Again, I'll find the greater trochanter, and then I'll locate the anterior superior iliac crest and the iliac spine, and I'll inject right here into the middle. Okay, so I have a doctor's order that's verified, and I have gathered my supplies. I'm going to be administering vitamin B12, 1 milligram IM every month using the 6 rights: right patient, right dose, right time, right medication, right route, and right documentation. So now that I have all my supplies, I can go ahead and enter my patient's room. Knock, knock.
Come in.
Okay. I'm going to provide for privacy and wash my hands. Good morning, I'm Kara. I'm a student nurse from the College of Central Florida. I just want to verify your name and date of birth, if that's okay.
John Smith, December 1st, 1983.
Perfect. All right, so I have a doctor's order that I verified to give you an injection monthly of vitamin B12, and that's an intramuscular injection, which means it goes into the muscle. Is it okay if we go ahead and use the muscle up here on the top of your arm?
Yeah, that's fine.
Okay, perfect. So I'm going to move my bed up. And put this handrail down to give me good access. Come back and wash my hands and get my medication. I'll do my first check. I have vitamin B12, 1,000 micrograms per ml. So go ahead and clean that off, and I'm going to need an IM needle and syringe. Allow that to air dry. And so I have vitamin B12, 1,000 micrograms per ml, and I need to give 1 milligram IM. So that would be 1 ml of solution. So I'll draw up 1 ml of air and inject it. And I'll draw back 1 ml of the solution. And change my needle. And then I'll verify a 3rd time that I have vitamin B12, 1 milligram IM, and I have vitamin B12, 1,000 micrograms per ml, so I need 1 ml of solution, and that's what I have. So I can put my medication back, and then wash my hands, don my clean gloves, and we've already identified the site on the patient there on the deltoid, but for the purposes of the video, I'm going to be using this injection pad. So I would clean my site from the inside to the outside, allow it to air dry for about 30 seconds, and then just as I identified, I'd be giving in the deltoid site, 90-degree angle, inject, aspirate. If I don't see any blood return, then I can go ahead and give my injection and put my needle directly into the sharps container. I can remove my gloves and in the trash and wash my hands. Is there any other questions or concerns that you have?
No, I'm okay.
Okay, so I can go ahead and put my side rails back up and have my call bell in reach. And I would wash my hands and provide for privacy.